AbNetCom Instruction 5360.1. Who's responsible for deceit and affairs? Who's responsible for the Casualty Assistance Calls program? You PERS. What programs related to but not part of the deceit and affairs program? I didn't hear that. Casualty Assistance Calls program. That's right. CACO. CACO officer. What is the CACO manual? 1770. View PERS instruction. What's the max allowable stopover time for an escort? 72 hours, but every once in a while they have 3 days. Some people don't know the difference between 72 hours and 3 days. But the test writers, they change it to 3 days, thinking that some of the people who go to my classes, they're going to screw them up. Some people don't know the difference between 3 days and 72 hours. Remember, if I'm called back as an escort, I'm treated like a civilian. Remember what I told you about the bum. If a civilian indigent dies on the steps of a naval hospital, he is entitled to everything except where he is buried. Remember what I said, if you had a disaster and you had a bunch of people die, you would have a group burial in the middle and authorization for transportation for 2 blood relatives and the primary and the secondary next of kin. Remember, the primary next of kin gets the flag. If the secondary next of kin wants the flag, then you would give it to him. Commanding officer's got to write a letter of condolence within 48 hours. Casualty Assistance Calls officer's got to make a call within 24 hours. What form is he going to give them next of kin? A DD 1375, which is a request for interment expenses. And remember that if they spend additional money, they have a right to get that money back, but they have to submit that form in 5 copies within 2 years. When you think 2 years, you also think of what? You think of deceit and affairs reports are kept for 2 years. You also think of prescriptions are kept for 2 years. You also think of the water test log is kept for 2 years. Remains will not be shipped to arrive at the destination on Thanksgiving, 22 to 26 December, and New Year's Day, unless specifically requested by the next of kin, because if they want it, it's going to happen. Remember that a person should be buried in dress blues, but if the next of kin wants them buried in whites or civilian clothes, it's going to happen. Remember, the escort should be of the same rank service as the person that died, but don't necessarily have to be. A special escort could be provided. Remember that government air is not authorized within CONUS, only overseas. What certificate of death overseas? A DD 2064. How many copies? 3. Along with 2 copies of the DD 565, which is a statement of recognition from all overseas areas except Guam. What's required from Guam? Civil death certificate. How many copies? 3, along with 2 copies of the statement of recognition, DD 565. Where does the original 2064 or civil death certificate go? In the health record. Remember that the Navy is going to do an autopsy if they want to. It ain't no biggie, but remember that if a person dies and they're an air crewman, an autopsy will be performed. Remains should be refrigerated at what temperature? That's an easy way to say it. What is it in Fahrenheit? 36 to 40 degrees, which is 2.2 to 4.4 degrees centigrade. An officer at a naval hospital that is assigned to coordinate the Deceit and Affairs program, the Deceit and Affairs officer is preferably a member of what corps? The MSC Corps. Remember that he is responsible to inspect the body and to expedite transportation. Remember that if you find additional portions of remains, you would notify UMED by priority message. Burial at sea, how far from the land? 3 miles, how deep? 100 fathoms, which is 600 feet. 6 feet per fathom. How many holes? 22-inch holes. Not 22, but 22-inch holes. How many bands minimum? 5 minimum, preferably 6 3/4-inch fans. Weighted to 300 pounds. What do you think of when you think of a 60% mortality rate? Aspiration pneumonia and botulism. What do you think of when you think of a particular grunt heard on expiration? Pleurisy and pneumococcal pneumonia. And remember that pneumococcal pneumonia is the cause of 60 to 80% of the primary bacterial pneumonias. What do you think of when you think of a reversible airway obstruction? Asthma. What do you think of the drug of choice? Epinephrine. What do you think of when you think of 30 to 40 bowel movements a day? You guys shit yourself to death. Non-specific ulcerative colitis. What's gallstones? Cholelithiasis. Remember, inflammation of the gallbladder is cholecystitis, and the symptoms for that normally follow a fatty meal. If a patient reported to sick bay with excruciating intermediate pain that originates in the flank or kidney and radiates across the abdomen along the course of the ureters, you would suspect what? Renal calculi. And if a person had renal calculi, what would you not give them? You would not give antispasmodics. What was the condition that I said yesterday that was most often seen in young adults? Regional enteritis. What disease has a sudden onset with steady severe pain located in the epigastrium and may radiate from side to side in the lower back? Pancreatitis. What did I tell you? What pain reliever could not be given for pancreatitis? You don't give morphine. You would give them Demerol, which is also known as what? Pyridine hydrochloride. And remember, if somebody has epididymitis, what might you have to do? Inject the spermatic cord with protein hydrochloride. What is the max dose of xylocaine with epinephrine used in dental? 300 milligrams. How about if you're suturing somebody up? 50 cc's of a 1% solution. What drug are you going to give for angina pectoris? Nitroglycerin. You would give 1 tablet every 5 minutes to use a max of 3 tablets. Did you guys get the ditty on the SSIC? Okay. Remember the difference between lymphangitis and lymphadenitis. Lymphangitis is what? That's a lymph vessel, and lymphadenitis is a lymph node. Remember what I said about diets. Remember the one is 2. Low carbohydrate, high protein is hypoglycemia. Remember what I said about diverticulosis. When you think low, you think high residue. And diverticulitis, low residue. What would you use to treat acute attacks of gouty arthritis? Anderson for acute, but remember, don't get it screwed up, because if they ask you about recurrent attacks, you're going to put Xyloprin. Zyloprin. That's on one of your study guides. Remember that gouty arthritis affects the toes, the ankles, and the thumbs. If a person had a pea or vegetable origin in a year, what would you try to get it out first? A wire curette. And if a wire curette failed, then you would use what? Irrigate it with light oil or kerosene. If you had an insect in the ear, you would first try a bright light. If the bright light failed, you would use kerosene or alcohol. But don't use the match. If a person had acute glaucoma, they would have intraocular pressure elevated over how many millimeters of mercury? 25 millimeters of mercury. What part of the body is not normally affected by contact dermatitis? The scalp. What conditions found in 2/3 of all adult white males were already found in black? Psoriasis. What's the most common dermatitis? Acne. What's the drug of choice? Tetracycline is a drug of choice, but what would you never give with tetracycline? Milk. What's another name for phenobarbital? Luminol is phenobarbital. What is another name for pentobarbital? Pentobarbital is Nimbutol. Know the difference. Don't say Robaxin. If a person had a fungus infection of the head, it would be termed tinea capitis of the body, corpus of the feet, penis of the nail, ungum of the crotch, versicolor of the trunk, curus of the trunk, versicolor. If a person had lice, if they had head lice, it would be termed pediculosis capitis. And if they had lice in the pubic area, it would be termed pediculosis pubis. What are you going to use? Quail, what percent? 1%. Another name for quail is lindane. And another way to get rid of them is to get lighter fluid. Squirt it in there, light a match, and when you run out, you stab them with an ice pick. What is the most widely used drug for migraine? Caprigot, which is also known as ergotamine tartrate. And what would help prevent cluster headaches from becoming vascular headaches? Cancer. What's contradicted in migraine? Codeine is contradicted. What's the drug of choice for trichomonas vaginitis? Flagyl. But remember, you wouldn't give it if the person was pregnant. What type of vaginitis is treated with monostat 7 vaginal cream? Monolila, or how you ever pronounce it, Monilia. And remember, if a person has bacterial vaginitis, you would check for intra and extracellular gram-negative diplococcus morphologically resembling neisseria gonorrhea. What's the incubation period? 2 to 9 days. And the causative agent is neisseria gonorrhea. Yes, ma'am. I think it says 2 to 9 days for gonorrhea. Well, check the book, okay? I know one thing in the book that it says that, I think it says that the incubation period for syphilis is 10 to 90 days, but that's another change. It's 10 to 10 days to 10 weeks. But if it says it's 2 to 7 days, then I've been teaching it wrong, and the symptoms for gonorrhea have been changed since a long time ago. But it varies anyway, because somebody might start having symptoms the day after. Remember that stomatitis is an inflammation of the oral mucosa. Remember that if you are on independent duty and you are working on somebody's mouth, you should always wear rubber gloves. I mean, that is understandable now. What's the cervix in dental? The neck of the tooth. And what's the chief hard tissue of the tooth which surrounds the tooth pulp is covered by enamel on the crown and by cementum on the root? The dentin. And remember also that it is the light yellow substance that makes up the bulk of the tooth, dentin, because they could ask it either way. If you had a picture on the tooth that was a wisdom tooth and it was inflamed, that would be called what? Pericorditis. That occurs more frequently in what age groups? 18 to 25. How many types of teeth fractures? 4. First you got a chip. Chip is type 1. What are you going to use to treat it? Sandpaper and varnish. 2 is slight pulp exposure. 3 is much pulp exposure. And 4 is fracture of the root. The only way you can confirm a type 4 is an X-ray. How many classes of dental? 4. 1 is white. 2 is green. 3 is yellow. 4 is red. And remember that red is assigned to somebody who lost their dental record or they haven't been seen by a dentist within the last 12 months. Yes, ma'am. Okay, that'll work. That's a way to check it out. I don't know where in the hell I got 2 to 9, but I've been teaching 2 to 9 for years. But it might be another book that says 2 to 9, okay? What's NUG? Necrotizing ulcerative gingivitis. Remember that if somebody has that, that is also known as trenched mouth. And the symptoms would be that they would have redness, swelling, and the gums would bleed very easily. What's an AdMed 6600/3? The Dental Health Questionnaire. Did you get the study guide on the diets? You filled them out? Okay, get it out. Okay, the treatment of hypoglycemia, remember what I said. That is the only one where you got 2. Low carbohydrate, high protein. If they ever ask you what diet is used primarily for all illnesses, the answer would be the high protein. Gastritis and hyperacidity would be a bland diet. Hyperthyroidism is high calorie. Renal disease, hypertension, cardiac conditions, when edema is present, low salt. Atonic constipation, spastic colon, high residue. Arthritis, hypertension, and diabetes, low calorie. Polio and TB, high calorie. Nephrosis and sclerosis, high protein. Hypothyroidism and cardiac disease, low calorie. Hemorrhoids and peptic ulcer, bland. And what is not recommended in a patient with a peptic ulcer? Milk is not an accepted practice, but what drug would you give them? You wouldn't give them aspirin. Infectious hepatitis and burns, high protein. And know that a person that is on a high protein diet for burns should receive 187.5 grams of protein every day. Post-surgical or convalescing from acute illnesses, infections, burns, and fevers, high calorie. Irritable bowel syndrome, diverticulosis, fluids are increased. High residue, remember, diverticulosis, think high. Ulceration, inflammation, intestinal obstruction, diverticulitis, and gastric disorders. Low residue. Renal disease associated with nitrogen retention, low protein, radiation injuries and fractures. High protein, what does it say in the 3 and 2 book? A bland, non-residual diet. Chronic nephritis, renal disease, kidney disease. Low protein. What do you think of in the lab when you think of kidneys? A kidney disorder. Cast and urine indicate a kidney disorder. How many grams does each, or how many calories each gram of protein, fat, and carbohydrate yield in its metabolism? 494, remember, PFC. Protein 4, fat 9, carbohydrate 4. What's the most common microscope used in the lab? Compound, which controls the amount of light that reaches the condenser. The iris diaphragm. What is the youngest form of neutrophil? A metamyelocyte, also known as a juvenile. It progresses from there to a band, also known as a stablet shape. S or horseshoe shape 2, segmented 2, hypersegmented. What's another name for a neutrophil? A phagocyte. What WBC increases in allergic and parasitic conditions? An eosinophil. What's the youngest form of neutrophil? I already said that, didn't I? What's the largest WBC? A monocyte. When you do a white blood cell count, the white blood cell pipette has a white pellet. You draw the blood up to 0.5 mark, and then what solution would you use? Either acetic or hydrochloric acid. You draw it up to the 11 mark. How long do you shake it? 3 minutes, not in a direction long axis. You do an RBC. RBC pipette has a red pellet. You would draw the blood up to the 0.5 mark, and then you would use 0.85% sodium chloride, also known as normal saline. You would draw it up to the 101 mark, and you would shake it for 3 minutes, not in a direction long axis. What's normal WBC? 4 to 11,000. What's normal RBC in a man? 5.4 million plus or minus 0.8 million in a woman. 4.8 million plus or minus 0.6 million in a newborn. 5.1 million plus or minus 0.9 million. And remember, the RBC in a woman is lower than in a man. How about the hematocrit in a man? 42 to 50% in a woman, 40 to 48. What is normal pH of urine? Normal pH of urine, 4.628. I heard 4 different choices. 4.6 to 8 is the normal pH of urine. What is the most convenient means for determining specific gravity? The urometer should not touch the sides of the container is read where? At the bottom of the meniscus. But if they didn't have a urometer on there, they had a thing that looked like a telescope. That is an index refractometer. What's normal specific gravity? 1.015 to 1.030. Pale urine with a high specific gravity is due to the presence of sugar. If casts are present in large amounts, the urine is always positive for albumin. And what test would you use in the lab for determining albumin? The sulfur salicylic acid test, and what would indicate albuminuria? A white turbidity. What's the best urine preservative? Toluene, because it seldom dissolves to produce false positives for albumin. What urine preservative sometimes dissolves to produce false positives? Thymol. Remember that if you collect urine, if you don't examine it under a microscope right away, you got to keep it in the refrigerator. And if you use a urine preservative, it puts a thin film on top of the urine, and when you pipette, you got a pipette below the urine preservative. You collect a 24-hour urine specimen, have the person come in at 8 o'clock in the morning, urinate and throw it away. You say that from that time until the next morning, and you collect it and you save it normal range. 802,000 cc's, average 1,500 cc's. What must always be reported in a microscopic exam of urine? RBCs, which are erythrocytes. What's normal WBC in urine? 0 to 3. Remember, anything more than 3 indicates a urinary tract infection. What's the KOH preparation test used for in the lab? Fungi. What did I tell you about mononucleosis yesterday? On the symptoms. The symptoms are practically always demonstrated by the 4th day of illness, but practically always by the 21st day of illness. Remember, on the RPR test for syphilis, if it is non-reactive, there will be a gray color. If it is reactive, what do you got to run? FTAAFB. And remember, if they don't have any of those tests on there, they're talking about syphilis, what are you going to run? Dark-field exam. Remember PMTM. P is. Yeah, it's a letter. Pathogens that reproduce best at 15 to 20 degrees centigrade are termed psychrophilic. 20 to 45 are mesophilic. 50 to 55 are thermophilic. And bacteria that reproduce best in reduced amounts of oxygen are microaerophilic. You better get hot. What we're going to start on first. Okay. We got to finish first aid. What number? If they have questions on your exam on snakebite, most of the time they're just going to ask you what is not grouped together or whatever. And if you had a coral snake, a rattlesnake, a crate, and a cobra, then which one's not matched? The rattlesnake. Remember that the rattlesnake is family Crotalidae, the coral snake, the crate, the mamba are all neurotoxic or Elapidae family. And that's the way they normally ask those. Which of the below is not true concerning definitive care of all Western Hemisphere snake bites except the coral snake? That's right. Children require larger, not smaller doses than adults do. What's the first step in treating an injury caused by a jellyfish or Portuguese man of war? You pour seawater over the injured area. What's the most widely abused drug to date? Alcohol, which is also known as ethanol. And remember that another name for marijuana is cannabis, but I doubt they'd be that nice and put something like that on your exam. I remember the first time I ever seen it on an exam, I was going for 3rd class, and I had no earthly idea what the hell cannabis was. What's the most important consideration when you're evaluating a burn? Extent. When you talk about extent, you're talking about the rules of 9 head and neck, 9% each arm, 9% anterior trunk, 18. But remember that in the book it's got to split in half. You got 9 up here and you got 9 down here. Same with the back. It's 18, but it's split in half. Each leg is 18, and the genitalia is 1%. If you can't remember your percentages, just draw your stick man and make sure that it comes out to 100%. If a man's burned on all extremities, he had what percent of his body burned? 54. Left arm 9, right arm 9, left leg 18, right leg 18. But read the question, because they might say the person is burned on just the anterior surface of the arm. That would be 4.5. He's burned on the posterior portion of the leg. That would be 9, not 18. So read the question. If a person was burned on the complete anterior surface of the body, what percent? 50.5. Complete posterior portion of the body would be 49.5. Ice water immersion would be used on burns of less than 20%. IV fluids are required on burns of more than. Same thing, 20%. Remember that very serious burns of the hands, the head, the feet, and the genitals require hospitalization. Remember that if you have serious burns and evacuation is delayed 2 to 3 days, you should use Silvadene dressings, Silvadene also known as sulfamylon, and the thickness of the dressing should be 1/16 of an inch thick. An acid burn in the eye should be flushed with water for how long? 5 to 10 minutes using 2,000 cc's of water. An alkali burn of the eye should be flushed with water for 20 minutes flat. Remember that if a person has a chemical burn in the eye, you should never attempt to neutralize it. But if a person has a chemical burn on the skin, the first thing you do is to flush it with copious amounts of water, but then you would try to neutralize it. If it was an acid burn, you would neutralize it with a mild alkali. If it was an alkali burn, you would neutralize it with a mild acid, such as vinegar, which is acetic acid. And an alkali would be sodium bicarbonate baking soda. An acid burn, if a man's burned on the skin caused by phenol, which is carbolic acid, the area would be flushed with alcohol. That's the only exception to the acid burn. What type of dressing must be applied to a patient with embedded white phosphorus particles? A saline-soaked dressing. Remember, your primary concern if a person has a white phosphorus burn is to put the fire out. As long as it is exposed to the air, it's going to continue to burn. But don't get it screwed up. Know that you would use copper sulfate, but the copper sulfate is only used after you get to the medical treatment facility. What heat condition is caused by loss of salt and water from the body? Heat cramp. What is caused by working or exercising in a hot environment? Heat exhaustion, which is also known as heat stroke or heat prostration. Which of the symptoms listed below are common to heat stroke? High body temperature. Which of those is not your concern to treatment of heat stroke? Temperature should be checked every 10, not 15 minutes. Remember that if a person has heat stroke, you would place them in an ice water bath, wrap them in sheets that's been soaked in ice water, put ice under their arm and their groin. You can take them out of the ice water bath when the rectal temperature reaches 102, and you would check their temperature every 10 minutes, and when back over 103, you'd place them back in the ice water bath. What is not part of the Command Prevention Center on the awareness of the environment? A heat calculator. WBGT is a wet bulb globe thermometer, and the PHEL chart is a physiological heat exposure limit. Patient reports to sick bay with ice crystals the entire thickness of an extremity. His skin will not move over bony ridges. Patient suffering from deep frostbite. Remember that if somebody has frostbite, If there is any chance that they're going to be exposed to the cold again, you would not thaw it out. Only if he's not going to be exposed again. Remember that the temperature of the water for thawing out a frostbitten part is 100 to 105. Whistleblower is not true concerning cold injuries. All cold injuries should be placed in a tub of water 100 to 105. Not necessarily. You might not have to thaw it out. But that's another nitpicky question. If you're in doubt as to whether a victim's an insulin shock or diabetic coma, you should give them sugar. What heart condition is caused by insufficient oxygen being circulated to the heart muscle? Angina pectoris. What's the most serious type of epileptic seizure? A grand mal seizure. What are you going to use? Dilantin, which is also known as what? Phenytoid sodium, but you could also use what? Phenobarbital, which is also known as what? Luminol. But why is Dilantin preferred over phenobarbital? Because it has no hypnotic properties. Childbirth is approaching and the mother's contractions are less than 1 minutes apart. 3 minutes. And know that massaging the mother's lower abdomen will aid in the delivery of the placenta within 10 to 20 minutes. Whistleblower is not true concerning emergency childbirth. You don't let her go to the bathroom just prior to birth, or she might have it in the commode. The protective gas mask is not effective against carbon dioxide and carbon monoxide. There's one thing that I want you to remember about carbon dioxide. Remember, the most common inhalation poisoning is carbon monoxide. But carbon dioxide, if you have fruits and vegetables in the same compartment and the temperature gets over 40 degrees, it calls carbon dioxide gas. What's the most common injuries seen by corpsmen? Soft tissue injuries. What is the most common causative agent for anaphylactic reaction? Insect, bee sting, and drug? Penicillin. What stage in the extrication of victims involves giving life-saving emergency care? Second. How many stages are there? 5. First is gaining access. Second is providing life-saving emergency care. Third is disentanglement, removing debris. Fourth is preparing for removal with special emphasis on fractures. And fifth is removal. Which of the below is true concerning rescue from fire or steam-filled spaces? Asbestos suits offer no protection in a steam-filled space. That is a true answer. What stretcher should be used to lift casualties from engine rooms, holds, compartments, or other areas where excess packages are small? Neil Robinson fits around you like a blanket. What stretcher is used for ship-to-ship transfer? Stokes. What stretcher is used to transfer a man from a boat? Stokes. What stretcher is used in the field? The Army litter. How long the hanging lines on a Stokes stretcher? 15 feet on each end. How many blankets? 3. How many straps? 3. Attached to the chest, the hips, and the knees. What is used primarily in the extrication of sitting victims, especially in auto wrecks, where it would be difficult to maneuver the victim out of position without doing additional damage to the spine? A short spine board. Whistleblower is not true concerning transportation of the injured. When you use a blanket drag, you should always pull the victim feet first, except when you're going down ladders. You know, I said that to every other class and nobody even laughed. Remember, probably the easiest way to move an unconscious person is the fireman's carry. But know the max distance is 150 feet. To move a person under a low structure, you would use the tie hand crawl or the blanket drag. To move a person up or down stairs or through narrow winding passageways, you would use the chair carry. What type of anesthesia blocks all impulses to and from the perineal area of the body? Saddle block. Know the most common type of anesthesia used by a hospital corpsman is infiltration. And know that topical anesthesia for corpsmen is limited to eye drops. And what is the anesthetic for the eye? Proparacaine opthane is the anesthetic for the eye. What stage of anesthesia is used for all operations? The third stage. How many stages are there? 4 stages. First is induction, second is excitement, third is operative, and fourth is danger. Blood pressure is normal in stages 1 and 3. Blood pressure is the highest in 2. Blood pressure is the lowest in 4. And the sense of hearing is increased in 1. This next question is no right answer. Street name for bepiridine is also Demerol. Same thing. Know that schoolboy is codeine. And the second one is a big one they ask on the exam all the time. Another name for the amphetamines is either bennies or cartwheels. Horse is also known as heroin. And dollies is methadone, also known as Dolphine. Take a break. Okay, what instruction name pertains to the disease alert program or report? AdMedCom 6220.2. A person or animal known to have been associated with an infected person or animal or a contaminated environment and to have had the opportunity to acquire an infection would be termed a contact. The transmission of an infectious agent by projection onto the mucous membranes of the nose or mouth would be termed direct. Airborne would be like you were in a room and you coughed and the stuff would still be in the air. Vehicle-borne is an object, such as a toy in diphtheria. Vector-borne is a flying or crawling insect. Which of the below is not one of the 4 international quarantinable diseases? Typhoid is not an international quarantinable disease. What was the ones that I told you were? Psych, P-S-Y-C. Remember that on the PHS 731, a yellow shot card. Those are the 4 international quarantinable diseases: plague, smallpox, yellow fever, and cholera. But the immunizations on the PHS 731, a yellow shot card, that must be authenticated by the actual signature of the doctor, is for all of them but plague, for yellow fever, cholera, and smallpox. God told it. What serious acute intestinal infection is characterized by a sudden onset, vomiting, profuse watery stools, rapid dehydration, acidosis, and collapse? Cholera. When you think of diseases caused by water or the fly, I want you to think of 3 diseases: cholera, typhoid fever, and amoebic dysentery, amoebiasis. What form of plague is transmitted by the bite of the infective rat flea, Exopetus chopitus? Bubonic plague. Remember that bubonic plague is the only one that's transmitted by the rat flea. Pneumonic and septicemic plague are spread by person-to-person contact. What mosquito is responsible for transmitting yellow fever? The Aedes aegypti. Know that they are the 4 mosquitoes of medical importance. The Aedes transmits dengue fever. But know that if they ask you what mosquito transmits yellow fever, they don't have the Aedes on there, or the Aedes aegypti on there, they want the Aedes. The Anopheles transmits malaria, and the Culex transmits filariasis and encephalitis. They may ask you what the causative agent is for amoebic dysentery, amoebiasis. That is Endomoeba histolytica. What infection of the colon is usually symptomatic? However, symptoms may range from mild abdominal discomfort with diarrhea containing blood or mucus, alternating with constipation, to acute dysentery with fever, chills, and bloody diarrhea. Amoebiasis, amoebic dysentery. What did I teach you the other day maybe I didn't teach you, but what did I say about botulism? 60% mortality rate, okay. Remember, botulism is caused by home canned acid foods such as green beans or corn. What's the only type of active hepatitis immunization currently approved? HAV vaccine. What term in viral hepatitis is now obsolete and should no longer be used? Hepatitis A. Which of the following diseases are not transmitted by flies or contaminated water? Relapsing fever. A question that they ask on relapsing fever. Remember that the causative agent for syphilis is Treponema pallidum, which is a spirochete. And know that relapsing fever is also caused by a spirochete. What type of malaria is the most serious? It's not characterized by recurrence. Falciparum. They may ask you what is the only type of malaria that's found in West Africa, and that is ovale malaria, O-V-A-L-E. What disease is characterized by a fever, 104 degrees Fahrenheit, coryza, which is a runny nose, severe cough, conjunctivitis, and copic spots on the oral mucosa? Measles. What's another name for German measles? Rubella. Remember, if somebody took a rubella shot, they're not permitted to give blood for 2 months. What's the medical term for a person with ringworm of the finger or toenail? Taenia ungum. Capitis is head, corpus is body, pedis is feet, and spirus is crotch. What systemic infection is characterized by persistent fever, headache, rose spots on the trunk, and lymphoid tissue involvement? Typhoid fever. You will never see an advancement exam for HM1 that they don't have a question on there that the answer is not typhoid fever. They might ask you what disease is transmitted primarily by the fly or water? Typhoid. They may ask you rose-colored spots on the trunk? Typhoid. They may ask you what is chloramphenicol used primarily to treat typhoid fever. What acute viral disease characterized by chills, headache, anorexia, malaise, fever, and painful enlargement of the salivary glands? Infectious parotitis, which is mumps. Which of the below is not true concerning pneumococcal pneumonia? The sputum smears don't reveal many gram-negative diplococcus, but read the other choices. Remember, it's characterized by shaking, chills, fever, chest pain, dyspnea, leukocytosis, and a cough with rusty sputum. Remember, the person would have a particular grunt heard on expiration. And it is the most common of all bacterial pneumonias, 60 to 80%. What disease is characterized by painful muscle contractions, principally the master and neck muscles? Tetanus, which is lockjaw. When you think of tetanus, think of a barnyard, think of a rusty nail. Which of the below is not true concerning sexually transmitted diseases? Treatment for non-gonococcal urethritis is not oral penicillin, sulfa drugs. What personnel are qualified to procure standard stock pesticides approved for use aboard ship and to conduct shipboard pest control programs if they've successfully completed the one-day course and half-day OJT training? Medical. Pest control operators are certified for how long? 1 year. Food service instructors are certified for 3 years. What insect ranks first in the importance of disease transmitted to man? Mosquito. They may ask you what insect ranks number 1 in the transmission of disease? Mosquito. What's number 2? The fly is number 2. The strongest insect traveler is the fly. And remember that larviciding is impractical in a large program because the breeding places are too scattered. What rodent prefers meat and fish for food? The Norway rat, which is also known as the brown rat. What rodent likes fruits and vegetables? The black roof rat. Remember, the black roof rat could be brown, it could be brown and white. The Norway rat could be brown and white, it could be black. But how do you distinguish between the two? The tail on the black roof rat is longer than the body, whereas the Norway or brown rat's tail is not as long as the body. Remember that when you use an anticoagulant rodenticide, the feeding should occur within a 10 to 14 day interval. The bait station should be replenished and inspected and replenished with fresh bait every week. And each container of bait will be marked in bold red letters, poison in English and also in the local language if you're in a foreign country. And the best rodenticide for use by a hospital foreman is warfarin. What is a not recommended food for rat traps? Cheese is not recommended. Steak and rind, peanut butter, and coconut are. They may ask you what is used to destroy rodents in their burrows, only outdoors. Calcium cyanide. If you use calcium cyanide on board your ship, you wouldn't have too many people on there because it is a, what type of gas? It is a blood gas, that's right. And what's it smell like? It smells like almonds. What rodenticide requires BUMET approval to use? Sodium monofluoroacetate, which is 1080. And the reason you need BUMET approval is because there is no known antidote. Which of the following water sources are not matched correctly? Snow and ice is heat. Distillation would be seawater. Remember that ships, when you are steaming at sea, water must be assumed to be polluted when ships in formation are less than 1,000 yards apart. In other words, if you're steaming with other ships, you can't make water until you're at least 1,000 yards from another ship. Who is responsible for assuring that a residual disinfectant of water is maintained? The Navy. Remember, the Navy gets the water from a municipality. The municipality is responsible to ensure that the water is pure and safe from contamination, but the Navy is responsible to chlorinate the water. Potable water obtained from an area where amoebiasis or hepatitis is endemic must be chlorinated or bromated how many parts per million after 30-minute contact time? 2.0. If you receive it from an approved source, it must be chlorinated to 0.2. Remember that everything is either 0.2 or 2 parts, except Lister bag is 5 parts per million. And remember that everything is a 30-minute contact time, except what? Iodine tablets. Iodine tablets must be what color? Steel gray and not stuck together. If you use iodine in a canteen, if the water's clear, you would use 1. If it was cloudy, you would use 2. Place the tablet in the canteen, put the lid on loosely. You would shake it for 5 minutes. Tighten the cap, let it set an additional 20 minutes. Total time for iodine is 25 minutes. If you disinfect water in a 5-gallon can, use an iodine tablet, you use how many? 20. Again, you would put the tablets in the 5-gallon can, shake it around for 5 minutes, let it sit an additional 20 minutes. Total time for iodine is 25 minutes. What is the only chlorine that's used aboard ship? 70% calcium hypochlorite. Which is below is not true concerning bacteriological testing and obtaining water samples. That's right, you would never collect water from a leaking spigot. But remember that when you collect your water samples, that you should turn the spigot on and let it run for 2 to 3 minutes. Know that a greenish gold metallic sheen indicates E. coli, coliform bacteria, or fecal contamination. Remember, the form that's filled out, if you do a bacteriological analysis of water, is a DD 686. Remember, you do a bacteriological analysis of water aboard ship every week, and you collect a minimum of 4 samples. What color comparator kit is simple to operate and suitable for general shipboard use to test water? The Palin DPD. Remember that is used to determine chlorine residual. But if you did a bacteriological analysis of water, you would use the membrane filter technique. How often must emergency water be inspected to ensure that the water is properly stored and safe for consumption? Every month. Who is responsible for promulgating instructions for ship-to-shore potable water connections and for providing potable water from the approved source when the ship is berthed at a naval facility? That's fact. Naval Facilities Engineering Command. A lot of times they'll just ask you who's responsible for the water if you take it from alongside a pier. What's the minimum amount of water per man per day for drinking aboard ship? 2 gallons, all purposes. 12 to 35 gallons, that's right. Hoses used for drinking water aboard ships should be labeled. Potable water. Potable water would be marked on the hose every 10 feet. What color nozzle? A blue nozzle. Remember, the only thing you can use seawater for in port is for fighting fires. If you take on fresh water, you should flush the hose with a chlorine solution of 100 parts per million. You should let it run for 30 seconds to 1 minute. When you think of 100 parts per million, you should also think of what? Green leafy vegetables of an unknown origin should be superchlorinated at 100 parts per million for 15 minutes or 50 parts per million for 30 minutes. How long should a chronological log be maintained indicating the date, source, or sample of bacteriological results obtained and action taken as a result of unsatisfactory water analysis? 2 years, 24 months. How far from the nearest land may a ship permit overboard discharge of untreated sewage? 3 miles, the same as burial at sea. Remember that you can dump trash and garbage, 3 miles, but you can't dump plastics. What fly may serve as a mechanical vector of the disease organisms in the same way as the house fly, but they don't prevent the same public health problems since they rarely enter dwellings? Blowfly. What's the easiest way for a cockroach to gain access to a ship? All of them. Bagged potatoes and onions, bottle cases, food packages, dry goods. What's the most common roach? A German roach's lifespan is 6 to 10 months. What's the most serious disease transmitted to man by mice? That's right, that's Tsutsugamuchi. The most common disease transmitted to man by mice is Tsutsugamuchi, which is scrub typhus. They may ask you, what is contact by walking barefoot in water with the infected snail? That is schistosomiasis, first choice. They may ask you what you would contact if you walk barefoot in soil. That is hookworm. They may ask you what is transmitted through close body contact causing an intense itching, especially at night, and that is scabies. What are you going to use if somebody has scabies? Quell, which is also known as Lindane, percentage 1%. Or you could use Protomycin, which is also known as Urax, percentage 10%. Because a lot of times they'll ask you what drug is a scabicide and also a pediculicide. That is Lindane Quell. Or they could ask you what drug is a scabicide and also an antipyretic. An antipyretic is an anti-itch, and that is Protomycin, Urax. Another question that's asked frequently is, what insect is not known to vector human disease, but they're annoying and they can seriously affect morale? And that is bed bugs. The safeguards to ensure a potable water supply and the details of chemical purification for ships are covered in the Manual of Naval Preventive Medicine, which is an NAVMed P5010. And what chapter? Chapter 6. 5 is water supply ashore. 7, wastewater treatment. 8, entomology, bugs. 9 is a new chapter, ground forces. Know that 1 is a big chapter in the 5010, and that is food sanitation. What's the only insecticide approved for aircraft disinfection by the World Health Organization? That's right, resmetirom. Who is responsible for operation and maintenance of the shipboard water supply system, production of an adequate amount of water, and ensuring bacteriological purity by chlorination? The engineers. And don't forget that. When you go on independent duty and you go aboard ship, you are responsible to test the water. The engineers are responsible to chlorinate the water. But I guarantee you they'll try to get you to do it. You ain't responsible to chlorinate it, just to test it. When structures are built for rodent control, all openings should be covered with what size galvanized hardware cloth? 28 gauge, 3/8 inch mesh. What's the outside diameter of a rat guard? 36 inch outside diameter. What should be used to control crab lice if they become resistant to quell or lindane? 1% malathion, that's right. What's the term used to denote a TB test reaction in which the largest diameter end duration is less than 10 millimeters? Non-reactive. If it is 10 or more, it is reactive. The definition of a converter is somebody who had a previous negative. They were 9 or less, and the next year they increased by 6 millimeters to a positive. That is a PPD converter. What test is used when you do a PPD? What's it called? It's called the Mantoux method. Under what circumstances must the PPD never be given? After you received a previous positive, you would never give it again. Which of the below is not true concerning the Navy TV control program? You wouldn't send a copy of the NAVMED 6224/1, which is a TV contact/converter form, to BUMED. Remember, the annual report of TV testing is sent to BUMED by 1 February. Remember also that the PPD should be read a minimum 48, max 72 hours. Also, if a person has a positive PPD, they should get a 6224/1. Know that follow-up studies are conducted at 3, 6, and 12-month intervals. What is used as the chemoprophylaxis in the prevention of TB? INH. Gamma-globulin is for hepatitis. Chloroquine is for malaria. Okay, get your other preventive medicine out. What naval publication is a preventive medicine manual? P5010. What's the name about P117? The Manual of the Medical Department. What's the name about P5095? Poisons, overdoses, and antidotes. What's the P5036? PD Interviewer's Guide, or SPD Interviewer's Guide. What's the 5038? CCD, Control of Communicable Disease in Man. What's the NAVMED P5055? That's the Radiation Health Protection Manual. What's the NAVMED P5041? That is Nobody Cares, Very Thoughtful People. That is treatment of chemical warfare casualties. The temperature in living spaces should be maintained at 70. How about the galley? 80 degrees. How about the meat cutting preparation room? 50 degrees. And when you talk about temperatures, dairy product box. The dairy products box should be maintained at 32 to 34. The chill box is maintained at 33 to 36. The thaw box should be maintained at 36 to 38. The reach-in reefer is maintained at 34 to 40 degrees. How about biologicals? 35.6 to 46.4, which is 2 to 8 degrees centigrade. Normally when they have it on the test, they'll just have 35 to 46. What's the temperature of milk on delivery? 40 degrees on delivery in the mess hall. 32 to 40 degrees. The tit is no greater than 1/4 inch. What is the temperature, the ideal temperature for the storage of eggs? 32 degrees, fresh eggs are not over 30 days old. And if they have any question on your exam about what temperature should frozen food be maintained at, 0 or lower. What is not destroyed by normal cooking? Didn't I tell you guys that? Staphylococcus aureus is not destroyed by normal cooking. What chapter in Preventive Medicine Manual pertains to wastewater treatment, disposal with shore and float? 7, that's right. Remember that water supply assures 5. Chapter 1 is food sanitation. I'm not sure what 3 is. How many cans are required in a model field dishwashing unit? 5 cans. How many's got boiling water? 2 of them. What's the temperature of the water in the cans? 212, that's right. What's the marine sanitation device, MSD system installed on most Navy vessels? CHT. And what would you use using the CHT? What would you use to detect leaks? The paper towel test. What's the temperature of the water in the final rinse of the dishwashing machine? 180 to 195. What is the temperature of the water for final rinse manual dishwashing? 170. You better not be getting your hands around 212. You ain't gonna have them long. Another question he asked concerning the MSD. Okay, the MSD system, paper towel test is used, and know that when you get done with your sewage, you should flush the line with high pressure salt water for 10 minutes. What refers to wastewater which originates from culinary activities, bathing and laundry facilities, deck drains, and other waste drains? That is gray water. And black water refers to human body waste, waste from toilets, urinals, soil drains, receptacles intended to receive or retain body waste. What type of individual disposal system is not authorized at Navy activities because it's the most primitive in all individual sewage disposal systems? The pit privy. And know the type of individual disposal system that's rarely found on Navy installations, but when they're found, they are used for single, isolated buildings. That is a cesspool, and know the difference. What's the recommended minimum square feet of floor space per person in unmarried personnel housing ashore? 72 feet. Or they may ask you what's the recommended minimum cubic feet of room space per person, and that is 500 cubic feet. How many showers should be provided in a barracks which houses 200 people? 8. 1 for every 25. How about commodes for 200 people? 10. 1 for every 20 people. You got to wait in line. The VD Interviewer's Guide contains instructions on completing and distributing the VD epidemiological report, which is what form? The NAVMED P5036. What's the PHS 2936? Yeah, that's the next question, isn't it? 505211 Alpha is also a publication on VD or STD. And the SecNav instruction is also the SecNav instruction on STD. The VD Interviewer's Guide. Yeah, what copy of the VD epidemiological report, which is the PHS 2936, is sent to the health department of the area where the contact resides? The white and pink copy. Know that the copy that is sent to the State Health Department is the yellow copy. Epidemiological investigations have shown that more than what fraction of all reported outbreaks of foodborne illness are the result of gross carelessness and deficiencies in food service sanitation? Half. Another question they ask all the time is, if you store meat at temperatures slightly higher than those recommended, it has what effect on the meat? It cuts the storage life of the meat in half. Also remember the one about the sandwich machine. If you have a hot sandwich machine, when you put the sandwich in there, you got to wait 2 hours, 120 minutes before it would be safe to drink or eat. A ship entering a foreign port must have a certificate of deratization issued by the United States Public Health Service every 6 months. What metal fume fever is caused by all the below except beryllium. And know that beryllium, if it's absorbed into the body in any form, leads to a chronic progressive disease. What is found in many rectifiers under certain conditions may break down and give off a brown choking vapor? Selenium. And know that asbestos can produce severe lung damage in the form of fibrosis. Is it? No, it ain't. That's on your other test. What agent is a factor in the development of cancer of the membranes lining the chest and abdomen? That is asbestos, but that wasn't the next question. When exposed to high temperatures of ultraviolet radiation, halogenated hydrocarbons decompose and form extremely toxic materials such as phosgene and hydrogen gas, both of them. What instruction needed pertains to the hearing conservation program? ABMEDCOM instruction 6260.5. What is A? It's occupational health. When you think of 2216, what should you think of? 2215 and 2216 are hearing conservation forms. 2215 is the baseline, 2216 is the reference audiogram. What personnel decontamination kit is used to chemically neutralize any toxic chemical agent you may have on your clothing or skin? An M258. Remember that each ship in the Navy will have a minimum of 2 decon stations. Remember, at the decon station, they will have metal cans with tight fitting lids. Cabinets and chests will be stenciled with a Red Cross and marked decontamination medical supplies. The cabinets and chests will be kept locked, and the key will be in the custody of what individual during emergency conditions? The DCA, the Damage Control Assistant. They may ask you what would be, or the first indication of a biological attack would be provided by what? Epidemiology, which is a lab exam. They may ask you what is the only protection against a biological attack, and the answer is a pressurized shelter. In the event of a known or suspected biological attack, all exposed or unpacked food not in critical supplies should be thrown away. And remember also, when biological agents are known to have been used, all drinking water must be boiled. What's the third priority for first aid and decontaminating casualties? Third is just like it is in order. One is control massive hemorrhage. Second is life-threatening shock and wounds. And third is decontaminate exposed skin and eyes. Fourth is remove clothing and decontaminate. Fifth is adjust the patient's mask. And sixth is first aid for less severe shock and wounds. Those are your different categories. Another question they may ask you is how are you going to protect an uncontaminated cut during decontamination? Impermeable tape. They may ask you what you would use to remove dry contamination. And the answer they want is just plain tape. What can be used for protection if you're caught outdoors after a nuclear explosion? What I told you the other day, a hanky. But there ain't anything about dislocating your neck. Which is below freeze water of radioactive material providing emergency drinking water. Distillation. Clothing that is grossly contaminated but in short supply should be either buried in deep pits or trenches or buried at sea and you walk around naked. After emergency treatment is rendered in the contaminated emergency treatment station, the nuclear casualty should be taken to the decon station. Remember that you would first go to the monitoring station. You have to have people at this station that are familiar with radioactive instruments. They would go from there, if they were wounded and contaminated, to the contaminated emergency treatment station. Once they were treated, they would go to the decon station. And then they would go to the sorting station, and they would be placed in one of 5 categories. And they no longer break that down. If they go to the monitoring station and they're not contaminated but they're wounded, they would go to the clean emergency treatment station, and once they were treated, then they would go to the sorting station. Get out your supply. What publication is the Operating Procedures Manual for Military Standard Requisition and Issue Procedures Mill Strip and the Military Standard Transaction Reporting and Accounting Procedure Mill Strap? A NAV Sub P437. Remember that NAV Sub P409 is the Mill Strap Mill Strip Death Guide. Which of below is not true concerning the ComNav Medical Material Support Command Instruction or Note 6700? That's right, it's issued every month by the commander of the Naval Medical Material Supply Command. What type of appropriation generally covers the current operating expenses of the Navy? An annual appropriation. Continuing appropriation will be indicated how? An X. Multiple year would be indicated by year/year. Remember that an appropriation is the authorization by an act of Congress to incur obligations for specific purposes to make payment out of the Treasury. That is an appropriation. Remember that the money that's given to the Navy runs from 1 October to 30 September. Your command is allotted so much money, and every quarter you spend money. If you don't use it, then you carry it over to the next quarter until you get to the end of the fiscal year, and then if you don't spend it, it goes back to the Treasury. But this is one of the problems with the Navy, because if you don't spend it, then they're going to cut your budget the next year, so these people go out and buy anything. Site commanders are required to supplement the AMOL with all the below listed supplies except lab supplies. In other words, lab supplies comes out of your hide, your AMOL, aboard ship. But the type commander furnishes first aid gun bags, airways and litters, and battle dressing supplies. They don't come out of the AMOL. The last 9 digits of the national stock number are known as the National Item Identification Number. How many numbers in the stock number? 13. Know that 9L indicates bulk medical supplies. What federal supply catalog class pertains to medicated cosmetics and toiletries? 6508. 6505 is drugs and biologicals. 6510, surgical dressing material. And 6515 is instruments, equipment, and supplies. What federal supply class catalog pertains to x-ray equipment and supplies, medical, dental, and veterinarian? 6525. 6520 is dental. 6530 is hospital furniture, and 6532 is hospital clothing. What's the ditty? The ditty on your supply codes. What? Okay. During chilly December, I deliver Christmas fruitcakes on King Zone. He's got a bunch of them if you don't have it. D is drugs and biologicals, 6505. $6508 is cosmetics and toiletries. $6510 is surgical dressing material. And when you think of surgical dressing material, think Band-Aids. $6515 is surgical instruments and supplies. $6520 is dental instruments and supplies. $6525 is x-ray equipment and supplies. $6530 is hospital furniture. $6532 is hospital clothing. $6540 is opticians supplies. $6545 is medical sets, kits, and outfits. And $6550 is in vitro sets, kits, and outfits. What measurement indicates the minimum quantity of a stock item that's required to support operations? That's the stockage objective. And know that the requisitioning objective indicates the max quantity of a stock item that should be kept on hand and on order to sustain operations. What part or set of the DD 1348 requisition system document is used by non-automated ships for requisitioning follow-up, modification, or cancellation and tracer requests? 2 parts. Remember, with the DD 1348, you only got 6 parts. 4 part is requisitioning from shore activities. And the 6th part is used for requisitioning from other non-automated ships and from automated ships when required. What documents should be used to requisition medical books and journals? A DD 1149. They may ask you what you would use to order BUMED-controlled items locally. That is also in 1149. But if you order BUMED-controlled items through the supply system, you would use the 1348. What's the DD 1380? That's the field medical tag. What's the DD 1375? That's the DD 1375 is the request for in-terminal allowances. Remember, if the next of kin spends any money, they got to fill it out in 5 copies, and it's got to be filled out and turned in within 2 years. All purchases from the Impress Fund are paid in cash, and no one purchase may exceed. Okay? That says that in the HM 3 and 2 book. What does it say in the 1 and 2? It says $150 except in an emergency, and then you can spend $300. So watch how it's worded. The max amount of money in the Impress Fund is $5,000. Usually it's only $1,000. Know about $10,000. They may ask you the purchase order of float is used for items in the open market, and they should not be in excess of $10,000. Yes. But the 3 and 2 book is $300, but by the 1 and cheap it's $150, because it says the max amount you can spend out of the Impress Fund is $150, except in an emergency you can spend $300. That's right. If they say what's the max amount of money in the Impress Fund, then if they've got $150 and $300 on there, I don't know what they want. You could look at it and you can visualize the supply section of 3 and 2. And if you think that's the section they're asking the questions on, then they want $300. But then again, a question like that, if there's any confusion on it, you should write to the exam center and say this question, didn't make sense or it's wrong by the book or whatever.